All right, so I had COVID in December, January timeframe. So one of the most frequently asked questions I get about having COVID is, how did you get it? And for that, we're going to have a discussion, right? Like, that's what we're talking about today. Like, spoiler alert, I wasn't a hermit that had a single person come and visit and I can say, that was the person or the way that I got COVID. I don't have that, right? So all I've got for you is anecdotal evidence and Occam's razor kind of explanations. But I don't have a conclusive precipitous event that occurred that I can say that's how I got COVID. But again, I've got plenty of anecdotal evidence that kind of says it would be very difficult for me to have caught COVID in pretty much but one or two manners. And one of them is pretty terrifying because we will have a whole lot more people with COVID if it were true. And the other way is just the normal, there was human contact. People didn't know they were exposed. They were, what's it called? Asymptomatic, so on and so forth. So, I'm pretty good about wearing a mask. I don't like the mask, but I'll wear them. I've got hand sanitizer in my door of my vehicle. Anytime I get out of if I, for whatever reason, do have to go to a store, a gas station mostly, right? If I have to get out of my vehicle, before I get back in, I usually sanitize my hands. And I'm also one of these weird idiots that you'd see standing there with my hands up like this, and people are like, what are you doing? And I'm allowing the dwell time, after I've scrubbed well on my hands, I'm allowing the dwell time and letting the alcohol and stuff evaporate, right? So I give it about a minute or so, 30 seconds at least, kind of sitting there, not doing anything with my hands, not touching anything else, right? So that I don't get transfer or whatever. All right, so I do masks pretty well. I do hand sanitizer. I wash my hands a lot. Wash my hands so much that I have to put lotion on them because they're dry as all get out. And that's because I scrub them all the time. So do I go to bars? No. Do I go into restaurants that are crowded? No. In fact, I'm pretty good about either drive-through or curbside pickup or stuff like that, right? There's a lot of restaurants and things like that. You can pre-order, you sit out in a certain parking spot, and they bring the food out to, the assigned space. Our grocery stores here in San Antonio, Texas do the same thing, right? They either deliver it, drop it on your doorstep, you wait for the driver to walk away, then you go out and pull the stuff in. Or you tell them what you want. They shop for you. You don't go in the store. They put all the stuff in bags for you. You show up to an assigned spot, right? You go into a certain parking place and they come out and they say, is this your order? Yes. And they load it in the back for you, and you don't talk to or go in or do anything, right? It's outside. The other thing you need to know is, for me, I'm an IT person. I work at home. I got a new job online, never been to the office. They shipped me my equipment, okay, at my house. I work from home. So all week I work from home. On the weekends, I own property out in a county, and I'll show a little statistic or whatever, the actual data from the Texas state, whatever, that's following the COVID cases here. My property is in Gillespie County. I got 25 acres out in the middle of nothing, and the entire county has something like 2,200 reported cases of COVID for the year, right? 42 deaths total. Normally their numbers for number of new cases reported, this week and this day is 0, all right? And again, I'm out in 25 acres. So not like there's a lot of people real close to me. There's not a lot of proximity. The town that's closest to my property has like I think population is like 750, maybe 1,000 or something like that. I mean, it's tiny. It has two little mom and pop gas stations and a Mexican food restaurant place. And they're not even the big cities, right? There's bigger cities. Fredericksburg, Texas, is one of the bigger cities in that county. So there's a whole lot of like no contact here, right? If I'm spending any time anywhere, I'm spending it either inside the house working, or I'm spending it out there at my property. I go to the gas station. I mean, it's outside and it's not like I'm close to people there. I do, again, all my shopping. Amazon delivers, right? Like, there's a whole lot of Amazon packages. I don't go places where there's people for the most part, right? So I do have kids, but my wife is real bad about, I mean, she's got those guys screwed down, right? My two boys have been school from home since the COVID thing was a thing. So she's pretty good about that. She's real good about not letting them go anywhere or do anything. I mean, it's not great for them, but they enjoy their going out to the ranch with me, right? Like that's our thing. So they don't go and interact with people. They're not exposed. They're not going in places. They're not going to friends' houses. They're not doing that type of stuff either, right? They're talking to their friends on their phones, talking to their friends in Zoom and that type of stuff. So eliminate that vector. So the two places that I do go in are probably the two stores that are the easiest to stay really far away from people. So I work at this ranch on random things and I need parts, right? So Lowe's and Home Depot are the two big box stores that I might go to. I wear masks. I wear I use hand sanitizer or wash my hands. Sometimes I wear gloves going in those places. And they're large places, like they're not confined spaces, and it's really easy. Those stores are really easy to stay away from people, right? So also because of the time when I caught COVID, like I kind of made up my mind. I can't say that I haven't been in any grocery stores over the past year, or that I haven't been to Target over the past year, or, I've been in a few places safely, right? But starting about December 1st, because of Christmas, I kind of put the kibosh on all of that. And the only place I was going in was a gas station, Lowe's, and Home Depot. All right, so you're probably thinking like, all right, Chris, you've given us a whole bunch of how you probably couldn't have caught COVID. What's the catch? What's the wrinkle? Where's the punchline here? All right, well, the punchline is my wife is a teacher. Now, she teaches small kids, and I've just recently heard that small kids don't tend to transmit the disease. I don't know if that's true. I'm not a doctor. Go check on the internet, validate that, put in comments below if that's complete bunk, hearsay, that's fine. But bottom line is, a few months before Thanksgiving, my wife got told, like, you got to come into the classroom. Now, it's kind of a dumb thing. Like, she's got to go into the classroom, and the kids in the classroom have to put up a computer and look at the same video screen that all the rest of the students in the class that aren't there. At home, they're using a computer too, right? So the course is still basically a virtual course, just the kids are sitting in a classroom to take a virtual course. Don't know why. That's politics I don't even care to get into. But the bottom line here is my wife does have interaction with other people. And now she wears a mask, she cleans her hands, she does the best she can with that, right? But there was one of her coworkers that we know, wife, husband, whatever, something was exposed. This person came to work, didn't have any symptoms, anything like that, and potentially transmitted amongst some of the folks there where she works, right? So again, this was because it was Christmas time. I got a little bit more. I mean, stores are busy enough and people are idiots enough to begin with. And then when Christmas comes around, Christmas and Thanksgiving and Black Friday and all that, I mean, we all know people lose their effing minds. So I wasn't going to have any part of that. had no desire to go out in that fray. And so I avoided that as best I could. And so again, anecdotally, like, how did I get this? Chris, how did you catch COVID? You know, if you're taking extra precautions and extra not going to stores, and I mean, I became a hermit starting December 1st, basically. None of the kids and I were going out anywhere other than the ranch in that county that has 2,000 cases for the year. So, like, how do we get it? Well, again, the Occam's razor part here, right? Like, the only explanation I have is that my wife got exposed to somebody at work, and she brought it home, right? And so I got a bunch of other videos out there of, you know, because I got it pretty bad. I have some of the risk factors, you know. I mean, I was significantly more overweight than I am now. You just go watch some of the other videos that kind of walks through the whole process of me checking in the hospital and the treatments and the whole bit. You know, if you haven't seen all that already, most people here are, you know, family and friends that are following my recovery. And this is like week 4 of me being out of the hospital, and I finally am not wearing oxygen and other things. But anyway, a lot of people that are watching how bad I had COVID are like, good grief gravy, dude. Like, how on earth did you catch this? With all of these, you know, anecdotally, all of these other things that you do or don't do, you know, how is it possible you were exposed to this thing? And again, the best, I mean, because my wife did catch it. All right, the kids did test positive, but those jokers, you know, one had a headache for a day and one had a stomach ache for a day, literally. You know, maybe they had a slight fever, 100, you know, 102 or 100.2, you know, that kind of thing. But no real fever to speak of, no real symptoms at all. But when they went and got tested, they all tested positive. Wife had some more symptoms. You know, I'm not sure she lost her taste. I know she had some diarrhea. She had some bad headaches and high temperature. Felt like she had the flu, you know, that kind of thing. She had it far, you know, less severely than I did, right? It was a very moderate to mild case for her. My case could probably be characterized as pretty severe. I didn't get intubated, but we were that close. So anyway, how did I catch it? The working theory, the best we've got, using Occam's razor and anecdotal evidence, the best we got is my wife went to work, you know, the week before Christmas break, right? Because she's a school teacher, there's a Christmas break. Week before that, she got exposed, brought it home, and I caught it from her. All right, so like I said in the beginning, that's the best I got for an explanation. I don't have any hard evidence, you know. I mean, is it possible that I, you know, wiped my nose from the gasoline pump or something like that? Of course it is, right? I mean, anything's possible. But in terms of, you know, me not going anywhere, staying protected with masks and washing hands and, you know, hygiene and all that kind of stuff, kids not going anywhere, all that kind of stuff, like not going in stores, not going in, you know, not even hardly visiting family or friends, right? Like, I mean, and even when we do that, we do like the social distance thing. So best answer we got is, you know, wife brought it home, and I actually ended up showing symptoms before she did. So we'll do I'm going to do a whole timeline one, which that'll be a hard video to do because it has some, you know, ugliness in it. But bottom line is, that's my best guess. Anecdotally, and just throw a dart at a board. You know, we don't know, and we never will know. But that's my story, and I'm sticking to it.